In this video, we will be covering all of the essential bony landmarks of the femur, patella, tibia, and fibula so you can ace your upcoming anatomy exam. We will cover key ligament attachments, muscular attachment points, and talk about the clinical relevance of these bones. To begin, we will start with the femur. This is the longest, heaviest, and strongest bone in the entire body. So right here we have the head of the femur. It's a nice round surface. And you'll notice on any of these, when they have a smooth surface on it, that's an indicative of an articular surface, meaning it's part of a joint. So of course this is our hip joint, and it is lined with articular cartilage, right? So to promote smooth joint motion. In the actual head of the femur, there is a divot right here called the fovea capitis. This is very important. This is where the ligamentum teres attaches, which stabilizes the head of the femur in the actual hip joint. Coming down here, if there's a head, there has to be a neck. So here's our neck of the femur right there. And then we have two very important bony landmarks up here. Right here is our greater trochanter. Greater trochanter, a lot of our hip musculature, the gluteals attached to this point to control our hip motion. And then if we spin the bone just slightly, right here is our lesser trochanter, okay? And the lesser trochanter is where our hip flexors attach, so very important. In between those 2 points, we have this line called the intertrochanteric line. Makes a lot of sense. And then if we spin the head of the femur back here, we have a couple more landmarks that we want to talk about. Right here is the trochanteric fossa, where that kind of divot is right there. That's what fossa really means. They indicate it's like a divot or a little dip in a bone, a valley. But it's not a foramen. A foraмен's a hole. The fossa is more like a divot. Back here we have the intertrochanteric crest, which sits again in between the trochanters on the back. And then we also have a gluteal tuberosity, which is right here. Tuberosity again just means a bony prominence, and this is where the gluteals attach. And then right here we have a pectineal line right here. And this is where the pectineus attaches. It's one of the main adductors that brings the hip in, one of those muscles there. As we move distally, we have two important structures here. You can see these two lines right here along the actual femoral, the back of the shaft here. And these are called the linea aspera. So we have a medial lip and a lateral lip. And these linea aspera are where the quads kind of actually wrap around and attach. And so they're very big muscles that actually go around to the back there. Again, this is just the shaft of the femur as we move down. And once we get to where the knee joint lies, this is where we start getting some more of our important bony prominences. And we can start with this portion right here. This is the patellar surface, also known as the trochlear groove. It's where the patella sits in the knee. And then over here we have a lateral epicondyle. And then over here we have a medial epicondyle. Makes sense. Epicondyle, epi meaning above the condyles. Another important point medially is called the adductor tubercle, which we can see right here. This is where the adductor magnus attaches distally towards the femur. And again, is that adductors are bringing the hip inwards towards the body. If we spin it around, we have a couple more important points here. So right here, these smooth, big surfaces are the condyles. So we have the medial condyle and the lateral condyle. And that will sit right on the tibia to form the knee joint. In between the two condyles, we have a intercondylar fossa, again meaning just a divot in between the two condyles, makes sense. And then we have an intercondylar line. And then up here we have two more important points. We have the continuation of the linea aspera. It just continues on down. This is the medial supracondylar line, meaning it's just above the condyles. And then we have a lateral supracondylar line right there. And then we have this one, the popliteal surface, appropriately named because the back of the knee is also known as the popliteal fossa. And we also have a muscle back here called the popliteus that sits right there. Looking at the patella sitting here in the knee joint right here, the patella is encased within the patellar and the quad tendon, and it moves up and down along the femur as we flex and extend our knee. And we can isolate our patella here to look at the bony landmarks. And we don't have that many, but the top is just called the base of the patella. The bottom of the patella, where it kind of comes to more of a point, is called the apex of the patella. And then right here we just have the anterior surface. And importantly, on the back we have again another smooth surface. This is where the patella makes contact with the femur in the patellofemoral joint. And we have two articular surface facets. They're called facets here. The lateral articular facet and the medial articular facet. And you can notice here that the lateral articular facet right here is a lot larger than the medial one. So if you were ever given a patella and asked to identify it, start by saying, okay, what's the top and the bottom? The bottom is going to be the pointed part where the apex sits right there. And then flip it around. And all you got to do is find the larger facet, okay? And that's how you know it's lateral. So if you find the larger one is going to be on the right side, you know you're looking at a right patella, like in this case. If the larger side's on the left, you know you're looking at a left patella. These bones make up your lower leg, and we're going to start again just at the top here. Some of these pins aren't super relevant, so we're just going to go over the major ones that you need to know. Okay, so we'll start at the top, and right here you see this little twin peaks almost, and this is called the intercondylar eminence, okay? And this is sitting at the top and sits kind of on that surface of where the knee joint is. The ACL and the PCL live here, okay, like kind of in between these eminences here. And then right laterally to that, we can see two smooth surfaces again. These are our facets. So here's our lateral facet and our medial facet. Just another trick, whenever you see the fibula, that's going to be lateral. The fibula is always lateral, so that kind of directs which one's medial and lateral when we're looking at these bones. Next, we have the medial condyle of the tibia right there on the side, and then we have another condyle. We just have the lateral condyle of the tibia sitting right there. One more really important point is the tibial tuberosity. We can see this little bony prominence kind of sitting right here in the front, the anterior aspect of the tibia. This is where the patellar tendon attaches, so all the quad force gets transferred through this point. And in younger individuals, especially younger athletes, before this growth plate that's used to be right here fuses. If they have a very big increase or large volume of activity, this could result in the condition known as Osgood-Schlatters disease, where you have traction apophysitis or inflammation of the growth plate where it's pulling there and you get anterior knee pain with that in younger individuals. We can also look at the head of the fibula here. So this is the apex of the fibula. Here's our head of the fibula. And if there's a head, there has to be a neck. Here's the neck of the fibula there. If we look at the back of the tibia here, there's two more important points here. We have the soleal line. This is where the soleus muscle attaches, and that is the muscle that sits right under the calf muscle. And then we also have a nutrient foramen right here, and here's our actual foramen. It's a hole, and nutrient because right in through that hole is where an artery will come into the bone to supply the bone with what it needs for nutrients. It gets rid of the waste there, and then also supplies the production of red blood cells, all the angiogenesis that happens in the body. The majority of the production of baby red blood cells happens in the bones. As we move down, there's a lot of pins, but it's basically just saying anterior surface, posterior surface. So in general, just know that this is the shaft of the tibia, and right here would be the shaft of the fibula. As we move distally, a couple more important points here. For the bones, the distal tibia and fibula form the talocrural joint with the talus. So that's our ankle joint. So our talus sits right here, articulating with the tibia and the fibula to form the ankle joint. Okay? And so we have really important structures here. Here is our medial malleolus over here. And then the fibula makes the lateral malleolus, okay? These are the two big bony prominences that you can palpate yourself. You can feel them on your ankle. They're very prominent. And a lot of ligaments attached to these to provide ankle stability and make sure our ankle is safe and sound while we're running and doing all kinds of activities. If we tilt the bones just like this here, we can look at the smooth surfaces of the inside of the talocrural joint or the ankle joint. These are the articular surfaces that articulate with the head, the dome of the talus, or the top of the ankle. And so we have the articular surface of the fibula, and then we have an inferior articular surface of the tibia, and then another one is just of the medial malleolus. But this is, again, where that talar dome is going to sit to make up the ankle joint. All of these bony prominences that we really talked about today are formed due to the muscular pull that occur on them. So for instance, for the tibial tuberosity right here, that's where the quads pull and create force, a tension force, a pulling force on that bone. And in response, the bone actually forms a prominence. And that's why there's a lot of anatomically named positions and landmarks on these key bones, which is super cool in my opinion. I love how our bones develop in response to the muscular activity that we exert on them. And those are all the major bony landmarks of the femur, the patella, the tibia, and the fibula. I hope this helps. I hope you learned something. Keep a watch for our next video where we'll go over all the bony landmarks of the foot and all the bones of the foot. Feel free to check out more videos on the channel. I am the PT Guy, educating you on God's wonderful creations. I'll see you in the next one.